Hello, my name is Abu Siddique. I am a senior lecturer at the Department of Economics at Royal Holloway, University of London. My main research interest is in the field of development economics, with strong overlaps with behavioral and health economics. In this video, I will be discussing a research based on a fieldwork conducted in Bangladesh in cooperation with BRAC. In this study, my collaborators and I examine how we can improve the mental health of Rohingya refugee women, as well as various socio-emotional, physical, and cognitive development of their children. Forced displacement affects millions of people worldwide, which can be due to various reasons such as conflict, violence, climate shocks, or even poverty. One recent example is the Rohingya people from Myanmar. Rohingya people are ethnic minorities who were subject to persecutions and violence by the Burmese military. This led to their large displacement to neighboring Bangladesh, where around 1 million Rohingya people live as refugees in refugee camps. Among the growing number of Rohingya refugees in Bangladesh, there are stark trends. At the time of this study, 55% of the 1 million refugees residing in Cox's Bazar were children, and 52% were women. In this camp setting, existing surveys show that more than 80% of Rohingya women suffered from depressive and emotional distress, with 60% experiencing post-traumatic stress disorders or PTSD immediately after displacement. Additionally, existing surveys and studies have identified that poor mental health among Rohingya mothers can lead to the neglect of children and adversely affect child development. To address this problem, BRAC came up with a simple program which is not only easy to implement but also low cost to scale up. The program is called Home-Based Humanitarian Play Lab, or Home-Based HPL, which involves psychoeducation, that is, educating people about mental health and why it is important and how it can get worse if not taken care of, and can provide various advice on how to improve mental health. We combine this with early childhood support for mothers, which involves play activities with their children and how to play with their children at home and the importance of play during childhood. We evaluate the impact of this program using a cluster randomized control trial, and our findings were promising. We find that the mental health of mothers improved significantly with reductions in psychological trauma and depression. Children also showed better socio-emotional and cognitive development after the program ended. Our results from this study encouraged BRAC to scale this program up among 40,000 mother-child pairs in the same refugee camps, which means 40,000 households are now getting regular mental health and early childhood support from BRAC. However, scaling up requires funding and other resources, which means supporting 30,000 children that are born every year in the camp would depend on external support and collaboration. There are various other things that we still don't know among the Rohingya population, such as how much they would benefit in labor markets from improved mental health, or how much the children would benefit during their primary education through improved early childhood environments. We also don't know if this kind of support would also benefit people vulnerable to climate shocks or those in extreme poverty. To answer this question, more studies and rigorous data collection are needed.